Cooper, and if you are, you will be terribly disappointed. We're amateurs here, folks, and sometimes things get a little rough. But let me assure you, we are doing the best, or I should say, I'm doing the best with my, quote, limited abilities. So before we get started, I wanted to point out 2 new products that we've developed right here at the Wellness Council of Iowa. In a few weeks, we'll be distributing our first ebook, 15 Important Ways to Engage Managers and Bosses in Your Wellness Program. It's full of great insight from wellness leaders of the healthiest companies in America. It is definitely information that you need, so go to our website, wellnessiowa.org, and reserve your copy today. Next, the For Your Health poster series are 4 colorful posters. They're 13 by 19 inches in size. They feature 4 simple wellness practices I think every employee should strive for: hydration, better sleep or rest, physical activity, and eating good food like vegetables. So the proceeds from these posters will help the council host more events like this broadcast and get your worksite moving in the right direction. You can learn more, again, about those at our website, wellnessiowa.org. Our broadcast today takes a little different look at wellness. So traditionally, we're speaking with for-profit companies who have robust wellness programs. And today, we're going to be taking a look at nonprofit organization with maybe somewhat limited resources. So with that, I'd like to introduce our guests. First, we have Gabe Carlson with the West Des Moines School System, and also with us is Tanya Fish from Wellmark, who works in concert with Gabe to help design and implement the programming there at the school district. Hi, guys.
Oh.
I'm a big fan of Gabe's work, and I think it's a shame that more schools don't do more to create a healthy environment for their faculty and staff like West Des Moines Schools. What you're going to be learning today is this district's programming strategies in the pursuit of a well school. So let's get started. Tanya, take it away.
Welcome. Thanks for joining us today. Well, our goal today is really to talk about the pursuit of a well school and how to develop a culture of wellness for faculty and staff. And we're going to go ahead and jump right in with what is workplace wellness, because this is a question that comes up, seems like a silly question, but it's a very important question when you look at thinking about workplace wellness or school employee wellness. So I want you to think about first, what does wellness mean to you as an individual? It may mean some of the things you see up on this screen, or it may mean other things. But what I think you'll find is if you think about wellness and how it pertains to your employees at the school, you may think of it differently. So for a second, just think about, what do you think about workplace wellness for your employees at your school? Again, I would assume some different words come up, and that's the important piece about assessing this. It's important to know when you set out to develop a workplace wellness program what you're looking to achieve and what you're setting out to do. So moving into this presentation, first we're going to skim through relatively quickly the business case for wellness. We feel it's very important to provide this to, should you be going to obtain support for a wellness program, that you have the facts behind why. Then we'll jump right into the meat of this program and the important part of how do you get started and what are best practices. And we don't want to be short-sighted. We really want to leave behind with you resources, because wellness can be a low-cost, no-cost solution for your work site, and there's a lot of resources out there for you that we will hopefully get you in touch with today. So jumping into the business case, I'm guessing it's no surprise to you, but there is overweight and obesity in our country. What you're looking at on this slide is 1995 and our United States of America, each of our states. What you'll see is there are 3 categories of coloring. Important first to note, though, that all states have a color. So by 1995, all of our states were measuring overweight and obesity to identify if it's a risk for them or not. What you'll also see is there are only 3 colors, our state of Iowa being in the darker blue. Now let's jump ahead 15 years, and we will look at 2010. So you'll notice there's a whole different set of colors, and those previous colors you were looking at no longer exist. And our state of Iowa jumped from that dark blue, 15 to 19% of obesity, to 25 to 29%. So the point is, it's only getting worse, folks, and it's not projected to get better in the near future unless we make some changes. So again, looking specifically at our state of Iowa, Iowa's the 20th most obese state. So we have about 26.3% obesity across our state. And that's projected by 2030 to climb dramatically up towards 54.4%. So there's opportunity, right? We have opportunity to potentially slow that growth. And the impact of that financially is enormous. So in 2020, it's projected that we will spend $2.059 billion on obesity. If we would reduce that trend by just 5%, we will save billions and billions of dollars, 5.7 to be exact. By 1990, 4.7% of Iowa residents were diagnosed with diabetes, and diabetes is directly related to overweight and obesity as a preventable way to curb that disease and the risk for that disease. By 2008, that number had jumped to 7%. So again, as obesity is climbing, the risk for diabetes and diagnosed diabetes is also climbing alongside that. On average, what we know is that folks that are overweight or obese cost more than those that are of a healthy weight. And the dollar amount is 42% more than those of a healthy weight, which equates to about $1,400. So this slide is interesting. What it points out is that the majority of employees that you deal with, regardless of the industry, regardless of their gender, their demographics, have a condition that they're dealing with. And what you'll see here is that these various conditions are preventable types of conditions that you can support them in potentially reducing their risk for. And if you would put 100 people in a room, it's somewhat alarming to think about the numbers that you see here and how many of those folks would be impacted with various risk factors. This also costs a lot. So 75% of our healthcare spend today is on preventable chronic diseases. And chronic diseases are also projected to account for nearly 2/3 of death in the next 25 years. So disease is a problem across our country, and it's something that we have control over.
Like the one that's startling to me, Tanya, is the 25% are still smokers. It's just startling to know that, given what we know about that thing, that people still continue to smoke.
True. And what you'll find here on the next slide is that environmental changes are also impacting our health. This is part of the reason why we are where we are today. So our lives have changed over time. We live very, very busy lives. And because our lives are so busy, we program nearly everything into our day. I think most of us could attest to the fact that we live off of a calendar and we plan our physical activity into that calendar. And oftentimes it's not natural movement, it's things that we program, like going to a gym or going to a class, etc. Something that's also planned activity that we have is PE and recess time. However, that's being reduced. It's interesting to think about that movement with kids, because walking to school was about 50% of kids in the 1970s walked to school. And today what we see is it's less than 10%. That takes about 3 to 4 miles of free exercise out of the day. Mm-hmm. And we can say the same thing for adults. We're not hunting to get our food. We're not moving around to get our food. We're walking into the grocery store and buying whatever's packaged up and easiest to prepare. Our communities have also changed. So you can call it the sprawl, the urban sprawl. We now drive on widened highways, interstates, and there's less room for sidewalks and safe areas, recreational type areas to move. And the norms have changed. So I think we all could attest to the fact that when we have rewards in our work sites, in the teachers' lounges, in whatever work site you work in, food is often the reward. And it's an easy reward, but oftentimes that food that we bring in as a reward is not of healthful content that's creating energy for your body. It's those things that are highly processed foods with lots of sugar. And we forget what healthy looks like when it comes to portion sizes, when it comes to clothes. it's important for us to kind of reassess what is healthy. And, you can even look at clothing sizes today. Our clothing sizes have adapted to how our bodies have changed. So, if you say a size 10 women's clothing, that's changed. It's bigger now than it previously was because the clothing manufacturers, they know that we want our sizes to be the smaller sizes or as small as possible.
Right, exactly. I can think about going to a restaurant too. I mean, you think about the healthiest option at a restaurant, and it's always looking for a chicken breast, right? A not fried chicken breast, which is very little to do with healthy food, like a whole healthy food, like apples or vegetables, anything that's easy to produce.
Good. So with the environment around us changing, what's also important to think about is that our daily choices are changing, because right now the surroundings that we live in makes it easier to be less healthy than it does to be more healthy. The options are often not healthy that we have that are easy. So it's looking to condition our lifestyles to make those healthier choices the easier choices. And why? Because we know that poor lifestyle habits drive health costs. And most chronic conditions are attributed to those basic lifestyle factors that our environment and our policy has adapted out of our lives. But not to be negative, Nellie, there is good news in all of this, right, folks? So the good news is we control 70% of those factors influencing our health. Oftentimes people use as an excuse their genetics. Well, I was just born with that. Well, in fact, that's partially true, but most of our risk factors are modifiable due to our behaviors and the environment around us, and the equivalent of 70%. So important to note, you at your schools have the power to influence. Why would you put wellness in place at a school or at any organization? Because you have an audience that is captive. They're spending a lot of time, more than half of their waking hours, at the work site. And we know that human capital is the leading business operating expense. The Society for Human Resources says 70% in total, but I believe, Gabe, when we were talking in schools, that's even greater.
Yeah, when you think about school populations, the whole capital of a school is basically the staff and teachers of a school district. So those are the key people of who's educating our students could be considered the product. We're not generating any kind of materials or anything like that. There's no overhead cost there. It's basically human capital. So, taking care of the people that take care of our children is the most important thing, I think, when you think about school districts and who we're really treating.
I think it's also important to point out that human capital, often we think it's the teachers. They are the conduit to creating healthy children. And while the environment around the children has been changing with the Healthy Kids Act and things of that nature, the teachers are the role models, and the kids look up to the teachers. So if they're making less healthy choices or leaving the classroom to go to the teacher's lounge to get chocolate, they're not necessarily setting a good example for those kids.
Right.
So it's really a prime opportunity to get those teachers set up to live healthier lifestyles and to make healthy choices so that they can influence those kids to do the same. So does wellness work? What we know, based on a study from David Lynn very recently with Capital Crossroads, is people do believe it works. And in fact, research says the same. So in the particular study that you're seeing here, it's a study of Iowa employers. And those in small businesses, 93% of them believe wellness works. And in large businesses, it's 97%. What we know is that programs that are comprehensive are the ones that generate outcomes. And when we say comprehensive, that's what we're going to talk about today. Comprehensive programs live by best practices and the framework that WellCOA promotes, the 7 benchmarks. And that includes leadership support, having a plan, watching for metrics and following them to generate outcomes. So those things lead to engagement, and they lead to programs that do work. To get to those outcomes can sometimes be a challenge because maybe you don't have access to certain data, etc. The reason we put this slide there for you is really so you can put dollars to various health risks that you can test and you can get participation numbers on and risk factors for. So this is meant to say, if you would focus on just one of these things, some of them are interdependent on each other, but let's say you focused on tobacco and that was your goal at your work site, to reduce tobacco use. By taking a tobacco user to a non-tobacco user, research shows that you could save $713 from that change. And then tack on to that weight and maybe reduced risk for blood pressure and cholesterol, which follow tobacco use.
Right.
There's a lot of dollars to be saved.
Yeah, I think this is startling information when you think about just the money that you're going to spend as a company on a person who is just having trouble kicking that smoking habit, and then combined with the other chronic conditions that are that develop as a result of tobacco use. Yeah, so this has been great information. Now let's take a look at some information specifically about schools.
Very good. So when we think about school employee wellness and best practices, the first thing that I suggest you consider is gauging your school's readiness for wellness. There'll be some questions that we go through coming up here that also generate you to think about this, but it's important to think about, is your wellness program tied to specific objectives and business goals? What do you want to achieve out of your wellness program? Are there specific goals that you're being asked to achieve or that you desire to achieve? Targeting those and focusing your energy, your resources, your programs on those specific goals and objectives is important, because then at the end of the day, you'll be able to go back and demonstrate outcomes. It's also important to look at how wellness is perceived by leadership and to have an understanding of that. Who are your key leaders and what do they think about wellness? Do they believe in it or not? And then how can you influence them if they're not a believer today to build their awareness and to get them to be believers and to be champions for you? And then other things, how does the company promote wellness activities? If you don't have wellness activities today, how do you promote any initiative in your school? And how can you leverage those communications to promote health and wellness? How does the company or the organization measure the success of other business initiatives? So I know in the schools you guys are measuring the outcomes of the students' achievement all the time and doing testing on them all the time. Is there any scorecard or dashboard that you share that you could wrap in some health-related metrics to? And then lastly, what recent initiatives has your school undertaken to control healthcare costs and enhance organizational performance? Be it training, be it ways to enhance productivity by eliminating waste. Leverage those things and think about how could having healthy employees lend itself to better outcomes in those areas that you may have metrics around. So we know, based again on the study that David Lind performed with Capital Crossroads, that there are challenges with workplace wellness. So these are probably things that if you haven't already come up against them, you may, and things that we want to be sure that we think about. So budget issues are often a challenge. Staffing resources are often a challenge. What we know is many of you may even be in the classroom today but be watching this later because your focus is on the kids during the school day. And people not being convinced of value, and you can read the others, but these are challenges you may come up against. So what we want to do next is connect you to resources to hopefully help you overcome some of these potential challenges. And the good news again is resources are plentiful, particularly in our state. We're blessed to have lots and lots of positive activity around health and wellness. So when you think about, gosh, I don't have any dollars for this, but I really think it's important and I really want to champion wellness at my school, things you might think about are community-based resources. So fitness centers, community centers, the YMCAs, which are pretty widespread. Hospitals often have programs, grocery stores, etc. Your insurance carrier may also have resources. So insurance carriers have nurse lines or personal health assistant type lines where there's health advocacy services or decision support services to help make healthy choices. There's also online tools like health assessments often available. Cost estimators to build healthcare consumerism out of your population and help them become aware of the costs of their disease and their lifestyle choices. And preventable health benefits. So oftentimes your preventive visits are covered from your health plan, and promoting that and encouraging folks to use those benefits is important. There also are many, many professional organizations that either you or others in your organization may be members of, such as the Society for Human Resource Management, the Chamber of Congress, the Wellness Councils of America being a great example in this arena, Live Healthy America and Live Healthy Iowa. And then a really nice resource that's out there specific to school is the Director of Health Promotion and Education School Employee Wellness Guide that might help you build the business case for your school. And not to forget state and national resources. Again, our State Department of Public Health has a plethora of resources out there, as does the Department of Education around employee and student health and wellness that you can leverage.
I think this is such a key slide, Tanya, because I think a lot of schools are wondering, where do we start? And we don't have any budget set for wellness. We don't have any head person to get it started. What do we do and where do we go? And I think this page really puts into a picture of what you can use. And Fuel Up to Play 60 and many national organizations have ready-made programs that schools can use to start doing a kid program, a student-based program, and then staff can take part in those things and join along, and that kind of helps create that culture. And maybe would spur something on to get another program started down the road. So just take advantage of some of these community resources. A lot of different companies and businesses would be happy to come into your school and do a presentation or lead your kids through an exercise program. There's so many things just that are right in your community. It could be a small town, it could be a large city, but they're there, and the resources are there just to use. It doesn't have to be extravagant and pretty, but there's a lot of things there that are available, and especially I think the online modes these days where kids are already doing that, staff is already doing it. Doing an online exercise program is so easy and accessible, and I just think all those resources in our community we have to take full advantage of.
And Gabe, you're using several of these in West Des Moines Schools program today. Is that true?
And we do. We use Live Healthy Iowa every year. We do that set program. We use Tavi Health programs that are based online, quick resources. We want all of our schools to do some sort of community or student-led activity. So whether they use Fuel Up to Play or Go the Distance Day, which is tomorrow, all of our schools are taking part of these programs that are on a state and national level, but we can do them right in our communities, right in our schools, and in our district. So we use these programs all the time, and they're a great way to get people engaged and starting to get the kids engaged and get the staff together engaged as well. So.
And also, I think you've shared that several of the schools are using student-driven health and wellness programs to engage the staff. Is that also true?
I think it's a great connection. I think, as a teacher, you're always in your school building and you're always in your classroom. Well, how do we reach the wellness message to you during your busy day? I think the great connection there is with your kids in your classrooms. A lot of our staff have quick videos that they can put in for 10 minutes in their classroom to get the students up and doing some jumping jacks and do a little aerobic activity. And then the teacher can do that along with them. And so it's kind of a program that's just right there in the classroom. It doesn't have to be too much time, but something quick and easy. And it presents the teacher as a great role model for activity and exercise. And it also gets everybody working and moving, and that can always help learning too. So.
Good.
We take advantage of all those kind of programs.
And I love, because when my child comes home from a setting in school like that, he's telling me to do the same thing. So it kind of translates from the schools out into the communities where the children are going home.
Yeah. And, in a lot of communities in Iowa, the school is the focus of the town. And so I think when the kids go out of the school into their own homes and into the community, that message is reverberating into the community too. And so I think it's a great ready-made source for a community to just expand that wellness message.
Which is actually a great segue into our next slide, which is about the Healthiest State Initiative. So again, we're very fortunate across Iowa to have support from the top in making our state the healthiest state in the nation as a goal. And because of the support of our governor and the Healthiest State Initiative, there's a lot of awareness around health and well-being. There's a lot of research being done. And there are many, many resources available like the ones we've shared. So if you're looking to start an employee wellness program at your school, right now is prime time, because you've got free engagement resources going out through the media every single day.
And that's really a program too, Tanya, that if you're not doing any kind of activity or any kind of wellness program, that's one place to start. I think in the fall when the Start Somewhere walk comes around, you can engage your whole staff, your whole school in that event. It takes 30 minutes, and it's just something that I think could set the stage for the rest of the year, saying, okay, we're going to do this Start Somewhere walk. Let's do it as a school. And then where do you go from there? Is there some other program during the year that you can kind of implement and just start small? And that's a great starting point. It says start somewhere. Well, that's a great starting point to generate your program through the school year, and it engages staff, it engages students, the community. You can do it. I think it's a great resource there too.
Good. And another great resource that's available again in our state is the Blue Zones Project. So there's research that's been done through National Geographic and a researcher named Dan Buettner across the nation, not across the world, over the past 8 years, and they studied communities and found those that had the most folks that were centurions, and brought together and researched those communities that had that to bring forth principles that were common amongst these communities. And now there's a Blue Zones project that's been piloted in Albert Lea, Minnesota. It's now going on in the beach cities in California and across our state in Iowa in 19 communities. And Blue Zones is a community-led well-being initiative designed to make healthy choices easier through changes to environment, to policy, and to social networks. So this is how you make sustainable change, through policy and through environment and through things that, once developed, are there to stay. So again, as these Blue Zone communities are being established and Blue Zone work sites are being designated across our state, it's something that you can leverage and use those resources for, and use the energy around it to help you in your employee wellness program. And the final thing we'll talk about across our state, again, there's a lot going on, right, is the community transformation grants. So this is something that the Iowa Department of Public Health is running through. I believe it's 26 different counties that brings about, again, wellness in various areas within the community. And it supports things like tobacco-free living, active living and healthy eating, clinical preventive services. So check it out. The website up here will help you identify whether your county is a part of this initiative and connect to resources should you want to be playing a role in that as well.
Yeah, I think we really have a fantastic opportunity within our state with all of these different projects going on. I can remember 3 or 4 years ago when the Wellness Council we had a chance to have Dan Buettner come and speak at our conference, and that kind of kicked things off in the state. What I love is talking with my counterparts, executive directors from other wellness councils across the country, and they say, what in the world is going on in Iowa? And I have to say, I don't understand it, but I am so happy that wellness is now the topic of conversation at almost every level. So we're just so very fortunate to have so many different resources. So why don't we talk a little bit about specifically what Gabe's program is like at the West Des Moines School Systems and some of the things that he's accomplished?
Well, Tanya definitely set the stage perfectly with the benefits of wellness and why we have wellness in our state and why it should be more prevalent in our schools. I think from a corporate standpoint, wellness has been around for quite some time, and the benefits of wellness has been stated. But I think in the school system, sometimes it can get lost. Being publicly funded institutions, do we want to set aside money for staff wellness? Is that an important part of what we do in a school as far as educating students? And when you talk about a limited amount of money allocation and should it all go towards students, I think the messages should be we need to make sure our teachers are strong, supported, educated themselves to then make sure our kids are that way as well. So I think there's a lot to be said about wellness in the schools. West Des Moines Schools has been privileged to have a wellness program since about 1986. There's been a staff person dedicated to wellness. And I think for the most part, our program has been structured to provide resources, services, programming for our staff and students. And until recently, maybe 4 or 5 years ago, we've been able to start leveraging some different resources within our insurance provider to get more information, to get our staff biometric information that they can use. And so part of that transition has been because of our leadership support and our program management. Our CFO has been just critical in our resources and allocation. We've had as far as structurally wellness-wise, we have a wellness team that is made up of one person in each of our buildings, and we meet every other month to kind of talk about our wellness program, what we're doing well, what we need to change. And they're also our barometer for the school system to say what's happening in a particular school and what kind of resources might they need. Just to give you a little glimpse of what West Des Moines School is, it's one high school and then an alternative high school. We have a 9th grade building, and we have 2 junior highs. We have 9 elementary schools. So within a system like West Des Moines Schools, there's a lot of different cultures and school systems that are at work. And I think there's schools in Iowa that may have a K through 12 building where everybody's housed in one building and you can do some programs together as a unit. Schools like West Des Moines, we kind of need to make sure our programs fit with each school's schedule, the things that they're interested in doing, and those wellness people in those buildings are critical in making those things happen on those building sites. The other system that we have is our insurance committee. We meet every quarterly and we discuss our insurance benefit system. And recently, wellness has kind of shifted into the benefit mold, saying how can we keep our costs down in the insurance realm, and what can we do from a strategic, systematic system to keep our costs down and keep our employees healthy.
I think the makeup, Gabe, of your insurance committee is part of the success factor with your program. Can you relay some of the players that sit at the table for that committee?
Yeah, sure. As part of our committee, we have, like all of you, our school systems are unionized, and so we do have a union leader within our insurance committee. We have a representative from schools and operations, wellness, our insurance coordinator. We have all these people meeting together in a room, and we make sure that wellness is always talked about in every meeting that we have. And then also, what are we seeing in our claims? What are we seeing in our participation numbers? And I think that shows some leadership within our school system to say, where can we go from here, and vision out a little bit where we're gonna head to. So I think that part is so important. I think as we go through this plan, we're going to talk about the 7 keys to wellness and just kind of lead you through what West Des Moines has done. And believe me, the things that we have done are not the setting the bar for you. There's so many different things that you can do in your own schools, and your schools have different cultures and systems and things that work. You just have to kind of fit wellness into what works for you. And we're just going to kind of go through some of the things that West Des Moines has done and the things that work for us.
Yeah, I think it's a perfect atmosphere in the school system because, I mean, how many total employees do you have at the district?
We have about 1,300 employees. That's full-time and part-time staff.
Yeah.
We have about 1,100 full-time staff members that are employed. And then, when you think about all the students that we have over 8,000 students. And so we're impacting a lot of people, not only teachers and staff, but also our students. And I'm going to probably come back to this a lot, but a lot of our programs are geared towards staff and student programs doing it together. And using that culture as a positive for wellness and kind of setting the standard that way.
Right, and from my perspective, I couldn't think of a more influential environment than a school. Not only are you affecting your employees, but you're affecting students as well. And then, as we mentioned earlier, there's usually at least 2 parents for each student. So you're infecting all of those folks as well with programming that you're doing. So I think it's just essential that schools really get engaged with wellness programming.
Yeah, that's well said. And I think, when I started in 2002. And really, the resources available to school districts was fairly limited as far as what do we do in a school system as far as health goes and wellness. A lot of things were geared towards the corporate world, and there wasn't a lot of things available for us. And so I think within the last 5 or 6 years, the resources have just quadrupled, and there's so many things that we can use from a community standpoint, from a national standpoint, a state standpoint. And of course, the governor having the push of the healthiest state. This is a great time and to jump in and start doing some programming and things related to health and wellness in your school. And really, it doesn't take much of a budget. you can do some small things to kind of get the ball rolling and I think
Right.
create a big difference.
Right. We talked about the Healthy Estate Walk as a simple free tool that everybody can use. It's just a tipping point in a lot of cases. And certainly, it's great to get your insurance premiums tied to discounts to that, maybe tied down. That's a great idea, but why not start simple? Start with a walk and then move into Live Healthier. I mean, there's a lot of great things that you can do that cost virtually nothing.
Right. And let's kind of go into the wellness program evolution. You'll see on this next slide, basically has the strategic points that you need to look at and complete to make a culture of well-being. And really, it has like a linear effect there, but you don't necessarily have to start at the beginning to get to the end. You can start anywhere on that linear line and just start where you're at. Say you already have a student-led program that, say you did the Start Somewhere walk and you're walking and you're doing it together. Well, where do you go from there? There's a lot of educational pieces out there available, newsletters, websites. You can start with educating your staff and pick maybe one person in your school district that really has a passion for health and wellness. Maybe they're a marathon runner. Maybe they like triathlons. You can pick somebody that can really deliver that message and deliver it well and maybe affect that one school in your system if you're a smaller school, or you can kind of make it grow out into your larger district schools as well. But you just need to start somewhere on that line and then just kind of keep adding and adding until you can kind of finally get that culture where we're always looking, what can we do better in the wellness world? Are our students getting healthy? Are they eating the right things? Are they being educated in this way? And I think that's kind of the evolution of a wellness program. Start where you're at now and then just kind of add and gradually change and develop into where you want to be.
I think it's also important to think about how you can integrate those various components along that continuum, because employee benefits are offered that support health and well-being, whether you think about it that way or not. And if you marry them up and consider them as you're educating, as you're creating awareness, as you're thinking about policy and environmental changes, thinking about a walk as an example, if you map that walking route that you're taking people out on and make that an environmental change, that you have the route mapped and promoted and that you're creating awareness of why to walk at the same time, you're hitting 3 of those things on that continuum to eventually drive continued walking, in this case, or movement, leading towards that outcome of culture of well-being, where people don't even have to think about it as much anymore. They just do it because it's part of who they are and what they do every day. So when you do start simple, think about ways that you can leverage that component of what you start with to expand upon it. Related to walking, again, if you're doing a walk, what employee benefits or discounts are available potentially that support walking? Maybe it's a discount to a fitness center. Maybe it's a discount on purchasing shoes. Promote that alongside your walk and your walking route promotion and the promotion of why you're walking to really connect all of those dots.
And another point with schools is that there's not miles, but maybe in a big school district like West Des Moines, there's miles of hallways that can be used in any type of weather, so you can't have an excuse to not do at least walking, which I think is a great thing. Tracks are almost every school has a track or a walking path. So again, walking is huge, and I would encourage you to figure out how you can use your own facilities to your advantage and get people moving.
So the next thing we're going to do is talk about 7 keys that you saw on that continuum a second ago to success in a school or workplace wellness program. And we're just going to talk about each of these a little bit, and then we're going to have Gabe share a little bit about how he's becoming successful in these various areas. So the first is leadership support. Leadership support is critical to the success of a program. And the reason why is because leadership makes any vision within an organization a reality, because they communicate about it, they put the resources behind it when it's important, and they don't let it go away. They also then will be asking to show outcomes. So the expectation and the energy around what you're doing will be sustained over time. So Gabe, when you think about your leadership, I'm guessing on the outset of the program, first you have to think about who are the leaders in this school? In the school system, who do you consider the leaders that impact your wellness program?
Well, there's no doubt leadership is a vital part of any kind of wellness program within your school. Obviously, when you look at a school system, you look at a superintendent and what kind of leadership he provides in the wellness avenues. And then if you have a business manager or a principal, those are kind of the chain of command, which can leverage money, can leverage time, can leverage opportunities for their staff. And I think the leadership, having that opportunity to get into classrooms, to be able to let teachers out from their school day and take part in some classes is critical. And as far as programming, there really is a limited amount of things that you can do without that leadership support. And West Des Moines Schools has really been blessed with that type of leadership that has allowed us to give funds and time and money towards wellness programming. So, and also when you think about specific schools within a larger school system like West Des Moines, as I mentioned earlier, having 15 buildings within our district, each building having a principal is so important in their leadership to their staff and their students. So maintaining those relationships with those principals to tell them why we're doing these programs, what's the benefit of them, and how they can better serve their teachers because they can participate in them is a key factor. I'll tell a quick story about Phoenix Elementary, which was one of our elementary schools. Their principal, Drea Boyd, is just kind of taken and running with this wellness message, and they've established around 2 or 3 years ago a Wellness Wednesday. And every morning on Wednesday, they take their kids and staff, and if their parents want to come join them, they're more than welcome to. And they take at least 15 minutes to do some sort of an activity, whether it's yoga, circuit training, some sort of a dance. And then they also have some sort of nutritious meal after that or snack. And so they're continually teaching their students and their staff every week about proper eating, proper exercise, and really taking that message to heart. And it just doesn't happen without a principal that dedicate some of their time within their school day to those things. And I tell you that a lot of the other principals see that as well, and they say, well, how can we do that in our school building? What kind of things work like that in our school?
Right.
And there's been just kind of a movement of programs within each of our elementaries that are doing morning or afternoon workout programs, and it's been a great thing, and it's one that we're really pushing for in our plan and our goals throughout the year, that each school does some sort of programming like that, because it's going so well, and it's a great way to activate and engage staff too.
Right.
So.
It's a good point to say, you don't have to get the entire system going at one time. Find a little niche where you've got a believer in wellness and get them rocking and rolling, because there is a whole lot of good that can come out of peer pressure. People don't like to be left in the dust of someone else. So when somebody steps out and says, I'm going to take on this, then usually someone goes, I am not letting that person get ahead of me. So you have to be ruthless in your wellness program to make sure everything keeps moving and that you're increasing participation. And that's a simple way. Just get somebody started, like one of the principals. And I should mention, Drea, at Phoenix, they were recognized 2 years ago as the Healthy Iowa Awards Healthiest School in the state. They've got a great program going there.
Yeah, they're doing some great things there, and it's kind of fun to watch those kids work out in the mornings. They love it. They look
Right.
forward to it every week. So if we can kind of move forward then to the next point, we just want to talk a little bit about the school plan. And the school plan is just a quick little snippet of what West Des Moines Schools utilizes for their plan. And this is what you can set up for your school to say, what are the things that are important? What are the things we're going to look at to kind of evaluate our program, where we are engaging our staff and our students within our day. And you can see some points there each year from year 1, year 2, and year 3. The list gets a little bit smaller and more narrowly focused, because we're hoping that some of those things in year 1 have already been done, and we can kind of move on to some other things. And I will say, within each of those years, we might pick out 2 or 3 general goals that we want to try to reach and really strive for. We're not looking to do every little bullet point on there, but that's kind of our overarching goal, and I think it kind of helps move your workplace into a culture of health and something that will kind of set the standard for what we're looking for. But for West Des Moines Schools, we might have 3 goals where we really want to see employees be engaged in their health screening and wellness assessment. We want to make sure that staff have their numbers each year, can take them to their doctor and really manage and prevent the catastrophic health issues that people may have. Another thing is we want to engage staff and students together in programming. We want to make sure that every school has some sort of activity program set aside during the year, whether that's the beginning or throughout the year or at the end. We want to make sure that something is being done at each school level. And so we just kind of break up our year into smaller goals, and this is a way just to kind of start planning out. So say you start with the Start Somewhere walk, or you do a Live Healthy Iowa with your staff. Okay, where can you go that next year? Where can you go that next semester to kind of grow out and develop your wellness program and your plan?
Certainly, an operating plan is essential in being able to measure your success and measure your results. And I know that we're going to talk about that in a little bit. But people sometimes are just like, I'm just going to get started with something. I think that's a great idea. But eventually, I think it's really important that you put a plan together, any plan of any amount, and then expand upon it through the years.
And then with that plan, understand what success looks like. So with any plan, you have to know where you're going. So understanding what you need to achieve and then setting the plan up around that is important. Like Gabe said, the focus at West Des Moines Schools is to understand risk, to get people to adopt preventive habits, and then to communicate and engage with the students along the way. And their plan is connected to that, and that drives that forth. They also have metrics that are connected to that, which we'll talk about here in a second.
Yeah, that's the one thing that our wellness program has really developed within the last 4 to 5 years. And you'll see this next slide. This is kind of our metrics. What we have done since I joined in 2002, we basically had an employee-paid wellness screening on site that staff could come and get their biometric readings. And that touched the people that were really into their health and wanted to know that data, which was maybe 20% of our population. It wasn't a great number. But how could we reach more people and make it more accessible? And you'll kind of see what we started here in this graph is we looked at from 2008 to 2013. And before 2008, as I said, it was employer-paid screening participant. In 2008, West Des Moines Schools paid for the screening of our staff, and that kind of bumped it up to 335 participants. That was a great bump from where we were, but it didn't incent people to actually go get their numbers. And as a wellness professional, we can give people information, we can give them resources, but we can't necessarily prescribe medication or things that might really help somebody that's beyond the preventative measures. But we want to make sure that they have those numbers that they can prevent that from happening. So in 2009, what we did, we also paid for the screening, and then we added a $100 flex benefit to those individuals that participated. And you can kind of see a very slight increase in 2009. What we found was the majority, unfortunately, did not have a flex account. And so part of the incenting is figuring out who you're going to incent and how you're going to do that.
Now, it looks like in 2011, you really found something to get people moving.
From 2009 to 2011, what we ended up doing is incenting with a debit card or a gift card to Valley West Mall. Everybody likes money. Everybody likes shopping, right? We did look at tying it into our benefit structure, but that was not a feasible solution for us in West Des Moines Schools. So we said, well, how can we utilize our self-funded insurance money to encourage people to get their numbers and participate in a well-being assessment? And so in 2011, we incented $75 to take a health screening well-being assessment. Great. And we also gave you $50 if your set building achieved 80% participation. So as you can see, from 2009 to 2011, we jumped up to 837. So right away when we offered this, people were jumping at it, and they loved it, and we got great response from it. And I think that peer pressure that Craig talked about earlier really benefited us there. So each school, if they reached 80% participation, got an extra $50. So I think that was kind of a big push to get people there. And then you can kind of see our numbers from 2012 to 2013. And I think there's another slide later on that we'll get to that kind of lays out our incentive structure and what we utilize to get those numbers, which we will see. But I think what was most important to me and the things that is great to see is we can actually see some numbers that are associated with these screenings. Before, when they were just employee paid, we didn't have a way to access how our district is faring health-wise. Right. Where do we stand? What are our health risks? What are our insurance claims going to look like with the health of our population? And this was one avenue that really gave us that hard data that we can actually see how are we doing and how do we program for the next year and make things different. And I just kind of, these aren't slides, but I just kind of wanted to give you some data that we were able to achieve from our wellness screenings. And I think if you can do one thing in your school district is just get people their biometric data and encourage them to go to their doctor with those numbers and let them know what their status is too. Just so they can year after year see what their numbers are and just really be preventative in their health. And it just gives us great feedback and numbers to see how our district is doing. And really, like the rest of the country, our staff ticked up this year in our BMIs by 1%, but all other factors, if you look at our numbers, glucose, total cholesterol, LDL, HDL, triglycerides, and blood pressures all went down from the year before. And we can kind of see how our work in wellness and the things that we're promoting and doing is making a difference. And that's always good to see.
So how,
it's important, too, for Gabe's program, once they got to that 80% goal, that 80% participation goal, which they targeted purposefully with that extra gift card, I'm guessing, that gave them population representative data. So once they got to that participation threshold, the other things you'll see on the slide are measures that they could get to demonstrate true risk change and true savings. So you'll see we measured cohort glucose, I think is what you're seeing on the slide, but we measured those folks who had been in the program over the course of time. How did their risk change compared to new participants? And then what's the cost of those that are participating in the program to those that aren't? And expanding upon how you're measuring over time can really get to the outcomes and demonstrate why you're doing this program and what it's doing for you.
Right. So how do you, I think it's it's essential that you collect data like this, but how do you use this information to move your programming forward on a year-to-year basis?
Well, it's great that you said that, because one of the things that we found this past year, especially on our well-being assessment, was a lot of our lifestyle habits in Western Wayne School are great. They're compared to the national average, but we found that our work environment needs to be improved. The support of our staff and what they're seeing during their school day, are their opinions being taken to heart and changed. There's a lot of regulations and things that teachers are really being faced with these days, and they're so busy during the school day. Do they have time for themselves and to take care of themselves? And I think we have to kind of balance the things that we're promoting, the things that we're wanting them to do, with what they need to do during the school day to make students productive. And that's kind of the balance that we have to look at. And as a district, we're saying, well, how do we make our teachers feel more supported, more cared for? And through our wellness assessment, we were able to kind of see that data. How are our staff really feeling truly when they're not in a meeting telling you how great they are, but when they're actually just filling something out and saying, maybe I'm a little stressed, and what can I do to kind of turn the table? So it's been very helpful in that regard too.
Interesting. So I know we have a couple of minutes left, and I want to make sure we get through all of our information. So why don't we jump to the slide that really discusses your incentive strategy?
Yeah, sure. And when if you are able to, if you are a self-funded organization and you can leverage your insurance budget for wellness programming, this has really taken our program to the next level and given us that data that we wanted, given our population of 1,300 employees the data that they really need. And as I mentioned before, as you saw those numbers kind of jump with participation, this is the incentive structure that we were able to use. 2008 was a screening funded, no employee incentive. We just paid for the screenings. That next year, we gave them $100 towards their Flex account. 2011, we gave them a $75 gift card for participating in the screening and the well-being assessment. And then that peer pressure thing was the $50 gift card for those buildings that achieved 80% participation. And that was a real big boost to what we wanted to get to and get closer to that 80% number for our district getting that assessment. 2012, we added a physical component to that. And this is not quite the correct data. I think this is the slide we forgot to change, but it was basically a $60 gift card for the screening and assessment, a $50 for participating in or getting 80% participation, and then we also gave them $25 if they would get a physical during during a year. So we wanted them to get their screening, get their numbers, and then also make that connection with their physician so they could address any issues that they may find in their assessment. I think a lot of times, especially maybe younger people, they don't really feel like they would have any issues. Why would they have high cholesterol? Why would they have high blood pressure?
Right.
And then they're kind of surprised when they see these numbers. Well, what do you do with those numbers when you get them? And so they can take those numbers to their doctor, get an incentive to do that as well, and then really create that physician participant number or relationship as well.
Right.
And I think that makes a big difference as well.
And you can see as you looked at Gabe's incentive strategy for West Des Moines schools, how it evolved over time. And that's important to assess. So it started simple, the incentive changed, and it evolved over time with more requirements as time passed to get people to move along that continuum to engage further.
Well, I want to thank you guys for coming in today and being part of this conversation. Certainly there's a lot to cover, and I think we flew through it. I do want to mention members of the Wellness Council have lots and lots of resources. We have some great free resources as well. You can find those by going to www.wellnessiowa.com/free, as in FREE. So again, thank you guys for being a part of the presentation. Thanks, Gabe. Thanks, Tanya. And you, everyone, have a great day. And be sure to be in touch with us if you have any suggestions for future programming or questions about today's presentation. So we're signing off. Have a good one. Thanks.